You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new breakthroughs in laser treatment options for the treatment of periodontal disease. If you have bleeding gums, loose teeth, bad breath, or are afraid of surgery, you have to hear what my first guest has to say. My advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options, breakthrough treatment options for people with periodontal disease. With us we have periodontist Dr. Tom McCawley. Dr. McCawley, welcome to the program.
Thank you for having me, Randy.
Now you say it's a breakthrough treatment option. Is it?
Yes, definitely. That's why I'm excited to be here, Randy. For the first time in the history of man, we have a new treatment option for those who have periodontal disease that produces minimal pain and discomfort without using conventional cutting and stitching. This new treatment is transforming the treatment of periodontal disease just like LASIK surgery has for eye surgery.
Okay, now how many people suffer, by the way, with periodontal disease, and what is it exactly? What defines it?
About 100 million people in the United States, 1 out of 3 have periodontal disease. And what it is, it's an infection, a bacterial infection that will show later how these bacteria get under the gum, invade the tissue, and cause you to lose bone. So about 40 million people actually end up losing their teeth because of gum disease.
Anticipating this interview, researching the topic, I guess not a lot of guys are using lasers to treat this problem. Why you? How'd you get involved early on?
Well, I got involved because I've always had an interest in the bacteria that cause the disease, and I lecture on that really throughout the world. So I was intrigued by the possibility that the laser could kill bacteria in the pocket. So then with researchers at the University of Missouri at Kansas City, we actually did a study that documented that. And we found that it actually did kill the bacteria in the pocket.
So you have published articles on this?
Right, in the Journal of Periodontology.
And you're past president of what?
Of the Florida Association of Periodontists, and also I'm on the board of directors of the North American Society of Periodontists.
Okay, tell me about the symptoms. I mean, somebody watching this, how do they know if they have periodontal disease? Is it gum problems, gum disease? Is it all the same thing?
All the same thing, but gum disease really is an infection of the soft tissues that gets into the bone. But the way that you would know it is that you have bleeding gums, red gums, loose teeth, or bad breath.
Okay.
But often it's a silent disease. So you need to ask your dentist or see a periodontist to see if they can measure any looseness around the gums.
So how is the laser different than what the traditional, the standard way that it's being treated nationwide?
Well, the primary difference, Randy, is that for surgery we use cutting, stitching, and grinding on the bone. For the laser, we simply use a laser light to go under the gum. And the difference is when we lay the flap out, you can see how you expose the bone.
That's a terrible picture. What are we looking at here?
You're looking at the tissue cut
and lifted up. Is this after the surgery or during the surgery?
That's during the surgery.
During the surgery.
During the surgery. We've lifted it up. We've taken
bloody procedure.
Yeah. We've taken the blade and cut the gum, lifted it up. Then we take this, grind on the bone.
So you scrape out what? The infection?
Scrape out all the infection, grind on the bone, loosen it up.
What is that called, by the way, that procedure?
That's called flap and osseous surgery.
Okay. Okay.
And then we suture it. We take these sutures and suture it closed, like that.
Is that painful, by the way?
Well, afterwards, it's usually pretty painful.
Pretty sad. But you say that's a thing of the past. I mean, with the use of this new laser, that doesn't have to happen. I mean, is that your message here today?
Correct. Correct. Now, for the first time in history, as I said, we can use the laser effectively to treat the disease, and we have studies where it shows that it increases bone density, and we have histology that in 100% of the cases studied, they were able to get new tissue, and 2/3 of them, they got new bone.
Okay, this graphic photo right here, this is how it's being done nationwide?
Correct.
So you call it cutting
and stitching.
And stitching.
Right.
Is how they're going in and cutting out
They're cutting away the infected tissue.
Infected tissue.
With the laser, we go in with this laser light and we stimulate the the cells to regenerate new soft tissue and
Does
bone.
a laser kill the bacteria by hitting it?
It kills the bacteria by hitting it, and we have that animation that we can look at.
So the results when you do either way,
Right.
the bad breath goes away, the teeth get stronger.
Right.
What else?
The result is that your gums tighten up, the bacteria are gone, you feel better, the teeth are tighter, and the bleeding is gone.
Now, with the people, how many people, by the way, are denture wearers nationwide?
40 million people have dentures.
And does it all start with this? I mean, periodontal
So here's
teeth?
what a denture looks like.
Okay.
So in contrast to your natural teeth, that's what a denture looks like.
Yeah.
You can't taste as well, it doesn't feel very good, and you don't chew. You chew about 20% as efficiently.
So the 40 million people that are wearing dentures, is it your opinion that if they get this treatment early,
Absolutely.
they wouldn't have lost their teeth?
Absolutely, Randy. If you get in early, you can stop this disease and save almost everybody's teeth.
Why aren't they doing it then?
They're not doing it because generally they're fearful. And that's the beauty of this procedure, because it allows us to treat this disease with minimal pain and discomfort. So now they can come in.
Knowing I was going to talk about this topic, told a few people anticipating this interview, spoke to a periodontist, and I said, what do you think about this laser? And they said it doesn't work for periodontal disease. That the cutting, as you say, the suturing or root planing, he called it, is the most effective way. What is your response to that?
Well, my response is that I understand exactly what they think. And I thought the same way. But after I investigated this technique, I found that there was some science in it, and that many patients, in fact most patients, were really benefiting from the treatment.
So it works. I mean, that's the bottom line.
There's
is
no
it
doubt
as
it works.
effective as the other treatment?
It's as effective as the other treatment, and maybe in some cases more effective, because it potentially regenerates bone where that rarely happens in conventional cutting and stitching surgery.
So cutting and stitching is what you call it. You used to do that.
Right, and I still, until recently, I did it often, until I became aware that this new treatment actually works.
Okay, not all lasers, you say, are created equal. They've changed over the years as well.
Absolutely.
Tell me about that.
The first laser I had worked fairly well, but this one has made some major modifications in both technique and how it works, so now it can be used safely because it eliminates the infected tissue and goes down into the bone and stimulates the bone. So now we get regeneration, so we no longer need to cut away tissue.
Okay, good. Now you brought a clip of the bacteria. Pretty dramatic.
Right.
So before we show it, why don't you set up what we're going to look at?
Well, what we do, one of the things we do is we want to diagnose what the real cause of the disease is. So this is bacteria that we've taken from underneath the gum, and then we look at it on a microscope, a phase contrast microscope, a spatial microscope that was somebody got a Nobel Prize for about 35 years ago. So we can actually look at the bacteria.
They've identified it.
They can look at the bacteria alive, and what you're going to see is little worms on there that almost look like termites. Okay, so if we pull
that up.
Yeah.
Okay, so the things that are moving are what? What are we looking at?
Well, first there's an amoeba in there, and you can see that's a protozoa, a parasite living under the gum that causes problems. But the little worms are like spirochetes. So it's just like in the forest, you turn over a log and look at all the stuff you see underneath it. That's what's going on in people's mouth who have gum disease. And that's why it can get into the bloodstream and affect their heart, lungs.
So when you hear that dental problems are related to heart disease and things like that, it's because of these, are they called microbes? What are they called, parasites?
They're bacteria.
Bacteria. And that seeps into the?
That gets into the bloodstream and settles on the plaque in the heart and makes them less stable.
So it likes what, calcium?
Well, it just finds a little niche. These are just little rough niches that we found. These spatial bacteria, we'll find them in most of those plaques, these bacteria.
Okay.
And they think that makes them less stable.
So you're saying that those things are either cut out or lasered out.
Correct.
The laser kills them.
Right.
And now the laser technique, is it virtually a bloodless procedure?
Yes, it's a bloodless
because
procedure.
Because logically I'm not picking up why every periodontist, because that's your job, is to take care of periodontal disease.
Exactly.
Why aren't they all doing it?
Well, the reason they're not all doing it, one, they're comfortable with what they're doing.
All right.
And two, they're skeptical about the results.
Does a laser, is it an expense issue?
Well, another thing is the expense involved. It's a very large expense.
How much is a laser?
Well, in our practice, we've spent $140,000 on the 2 lasers we have.
So that's the future then?
It's the future
of
without
periodontics.
question.
I mean, everybody's going to have one of these eventually.
I believe they will. Once they understand and see the results that people are getting with it.
So they are getting results?
Yes.
They just don't believe it?
They don't believe it. They haven't really investigated. When they go and look at practitioners like I have who do this therapy, they'll say, wow, I should consider this.
Now, you're one of the only guys in Florida, I guess, with this technology.
Right.
Is that right?
I'm the only periodontist in Broward County or Palm Beach County that has it, this laser at the present time.
Now, you said in the green room that you're having fun doing this for the first time in many, many years. I mean, you're really having a lot of fun. Why? Tell me about that.
Because now patients come in and instead of being fearful, they actually are happy when they leave our office. So instead of this kind of procedure, we now do a procedure that causes minimal bleeding, pain, so the patients are smiling, their lives are changed, they now have their teeth.
You say these people live lives where they have to stand far back because of the bad breath.
Bad breath, right. So now that changes their lives because bad breath affects the whole quality of their life, and the fact that they even save their teeth, they have their natural smile.
So this is a quick fix. I mean, is it one of those things that could be for certain people caught early enough, a quick fix?
Absolutely.
Put a laser in there, kill the bacteria.
Absolutely.
And that's it.
It is a one-visit treatment. That's the magic of it. However, you still have to come back for regular maintenance and do your flossing and brushing.
Do they complain about pain?
No. That's what's surprising about this to me, and that's why it's so much fun. When I call them to check on them, they say they have minimal pain.
Okay.
That's
what do you
good
give
news.
them, like an ibuprofen or something?
Ibuprofen is the max we give them, and sometimes they don't need to take that.
Okay, now you have a clip of the surgery, the laser surgery.
Correct.
To get rid of the periodontal disease.
Exactly.
Okay, let's take a look.
Okay. So Randy, this is the laser surgery, and you can see how the flashing there, that's the actual vaporizing the bacteria and the infected tissue in the pocket. But doesn't that look a little easier than cutting the gum?
So really there's no blood?
There's no blood.
So you're not cutting the gum there, you're just, the light, the laser is going...
The laser light is going under the gum and removing the infected tissue and killing the bacteria. So wouldn't you rather have that procedure than the cutting?
You say your wife has 4 pockets.
Correct.
In her teeth. What does that mean?
Well, that means, as you can see in this photo, that underneath the gum is loosened around the gum so that we can now use our millimeter scale to go underneath the gum.
So is that how you diagnose it, by the way?
Right. In fact, that's an important tool, this millimeter scale.
So you ask the dentist what?
You ask the dentist, please check my gums. How tight are they around the tooth? If it's 5 millimeters or more, I likely need gum treatment.
Because as it separates from the tooth, that means bacteria
get down in there and then they get into the bone.
Now, why are you letting your wife walk around with 4 pockets?
Because she doesn't want the surgical treatment. Now we're going to use the laser. We're going to use the laser. She actually asked me to do the laser.
She said, I've got to do this.
I've got to do this.
Okay, now you have an animation too to describe, and I guess our goal here today, because we talked, you said, Randy, I'd like to get on your program and lower the fears, because these patients, I guess, are suffering from bleeding gums, bad breath.
Right.
And that if they knew this was available, they would all run in and do it.
Absolutely.
And it's as simple as you're saying.
Absolutely.
Okay, so this animation, what is this?
So Randy, this is a 3D animation of the third, and you see the laser going around, and the thing that's unique about this laser is that it's attracted to red and black things, so it's removing the infected tissue as it goes around and not destroying the unaffected tissue.
So normally you'd have to scrape that out with a knife.
Yes. It also, you saw how it was killing the bacteria there.
Okay.
Now they're going to take the laser back in there, and they're going to use they use ultrasonic instruments, because this also loosens the calculus, so it's easier to get the tartar off the teeth and the bacteria coming off the teeth there. And we use some antiseptics there. Now the laser goes back into the pocket and goes down to the base of the pocket and takes the rest of the bacteria, goes down to the bone and stimulates the bone, and that's the thing that the laser does, biostimulates the bone so that we get new soft tissue attachment and
so the
bone.
teeth are loose before and they now get a little stronger.
See this blood? It also makes the blood coagulate, almost like when you you have a scab on your arm just before it turns into a scab. It's real sticky. Then you stick this back in there, and it forms like a biologic bandage to keep the epithelium and skin from going back down in there.
Is it tricky? I mean, is it technically demanding for you? I mean, there's a big learning curve?
Yes, there is a big learning curve. That's what was surprising about the technique. I thought it would really be easy, but it's very complex.
I mean, you've been using a laser now for almost 20 years?
I have.
Okay.
And this technique is not only the same laser, but many advanced techniques on it, but the new procedure is patented.
Do you have to wear little goggles to get into a tight area?
You do. We use magnification to get down and see how we're doing, and protective glasses.
Now we're going to take a quick break. We come back, more about the process. Okay, so somebody thinks that they have or knows that they have gum disease, gum problems. What happens on day one? How long the diagnosis takes?
Sure.
And all of that stuff. So let's take a quick break. We'll come right back.
Okay.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, more information about what you need to know about new treatment options if you have periodontal disease. We'll be right back.
Actually, I was kind of excited and looking forward to it, being that I've seen the tremendous leaps that dental care and dental treatments have done over the future. To my recollection, I would have to say I'm a compliant patient, and I believe that I was able to kind of like eat right away, but I didn't. But I do remember that the pain was nowhere near as significant as I might have anticipated it to be. It was really minimalized, especially on the laser side, and that's absolute truth. I've had both. I love my teeth, and I would probably opt for the laser procedure.
It was fine. I mean, it just went very smoothly. I didn't feel, I can't say no discomfort, but minimal discomfort. I didn't know what to expect, and I was pleasantly surprised. Well, I wouldn't tell them not to hesitate at all. That it was fine. It went smoothly. It was not uncomfortable at all, and the after effects were so slight I don't recall any. Dr. McCawley just turned out to be a great guy. He was a great help to me. I was looking for someone. I didn't know what to expect, but almost from the moment I met him, I knew that I was in good hands. He treated me with respect. He treated me with a business-like attitude, but also I think we developed a nice rapport, and I felt very comfortable in his hands. The staff is fantastic. I think they're very caring and friendly, and their professionalism, I think, is really the word to use for the staff.
Tried all sorts of cover-ups for bad breath? Try the science of BreathoRx. Only BreathoRx has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription BreathoRx from your dental hygienist and now at fine stores everywhere.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light superactivates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We are here with periodontist Dr. McCawley, and we're discussing about breakthrough treatment options with the use of lasers and periodontal disease. Is that correct? Did I get that right?
You got that right correctly. So the process is, when they call our office, they'll come in for an examination. We'll test their pockets, we'll test the bacteria, and we'll take some radiographs.
Who does this, by the way? Do they ever meet with you on?
Oh yeah, I'm doing the examination to complete. They'll be there probably 45 minutes with me alone. Then we take all that information, put it together, have them back for another visit, and then we explain to them how the process is treated. They have the choice of choosing conventional cutting and stitching or laser treatment.
Well, who would
as you know, it's a no-brainer. Almost everybody chooses laser treatment.
So the main reason why these people put up with the bleeding gums, loose teeth, bad breath in this, is because they think it's a major surgery.
Correct.
Is that the perception, the word on the street out there?
Absolutely. They think it's a major surgery. They don't know that now we have a one-visit treatment that they can have minimal pain and discomfort afterwards, and their teeth can tighten up.
Now, other doctors will watch this show, periodontists will watch this show, and you say less than 1% nationwide are using this for the treatment of periodontal
Correct.
disease.
There's only 700 lasers in the country right now.
So doctors will watch this show, and like you say, less than 1% are using this to treat these gum problems. What do you want them to know? What do you say to them, the ones that are skeptical?
I understand their skepticism. I was skeptical. It took me 3 years of investigating this laser, talking to users of it, to become convinced that it actually worked.
So the technology is there.
It's
because
there.
some might say it's not there yet.
They just haven't really investigated. They're just blowing it off.
Now, you love this treatment. You say this is the happiest group of patients.
Absolutely.
Of all patients in
They
dentistry.
will love it, and in fact, I predict that in the future, many of them will get it.
Okay, what happens? You say you're changing people's lives. You do the treatment, what happens? I mean, how are their lives changed?
Well, their lives are changed because, first of all, they can get treatment for gum disease. Before, they weren't even coming in.
Okay.
So as I said, with the patient who was crying, now she comes into the office, she's happy.
All right.
And now our patients come in, they're happy. They see our staff here.
Now, you brought a picture of your staff.
Right.
Why'd you do that? Why'd you bring
The reason I brought a picture of our staff, because our office purpose is to have high tech and high touch. And we've selected these people
Looks
because
like you guys are having fun in this picture.
we're having a great deal
That's
of
your
fun.
office?
No, that's not my office. That's actually the lobby of the Ritz-Carlton.
I see, okay.
So once a year we go on a 3-day retreat.
Your staff?
Our staff. And we have a great time, and we learn how we can treat patients better.
Is that right?
Yeah, and this year we're going down to Hawks Cay in the Keys.
Okay, good. That's good. So hold it just like that. Let me ask this next question, then you'll put it down.
Okay.
I'm going to ask the question about, we haven't talked a lot about symptoms going away. We've talked about the woman now is not afraid to go in, but their breath, you haven't said it, their breath goes away, this and that, or they're feeling better. But it prevents, so I'm going to be dry here today. So it prevents future tooth loss. Here we go, and you'll comment about that. So it prevents future tooth loss.
Absolutely. It stops the infection. They no longer lose bone. They may actually regenerate bone. So they don't lose their teeth, which affects their smile. They get fresher breath, and they no longer have bleeding gums. What could be better than that?
What are the frequently asked questions? On the consult, you say you do the consults. What do they want to know, these people with periodontal disease? What do they ask every time?
Well, they ask lots of things. One, they want to ask, does it hurt? No. Will I have discomfort afterwards? No. Will I have recession? No. Will I have sensitivity? No.
Yeah, sensitivity. I heard that. That's the big problem with the lasers.
No.
Not true?
Sensitivity is a big problem with surgery. Sensitivity, the laser actually keeps the tissue at the height so you don't have sensitive roots.
Now, I guess this is a big discussion. We're completely out of time. But you say that this bacteria, the people watching this that have this, they know who they are, obviously, bleeding gums, bad breath, swollen gums. that this bacteria can leak into their system. Is that an exaggeration? Is there any science behind this? That means it gets into the bloodstream?
Definitely. That's one of the important reasons why treating periodontal disease is critical. And as I said, it's a tragedy when 100 million people have periodontal disease and they don't get in because of fear. With the laser now, we can treat the disease, get rid of the bacteria, and studies have shown that periodontal disease affects heart disease and stroke, so not only can we possibly save people's smile, we might just save their life.
Do you think you're saving lives?
I do. I think that gum infections cause inflammation, the bacteria get into the bloodstream, there's no question about that. And I think that by treating the disease, not only will people have a nicer smile, but they actually will be able to save their life.
Final message, we're out of time. Very interesting, by the way, good information. Somebody watching this, they have the symptoms you talked about. I guess swollen gums, bleeding, bad breath, loose teeth. What do you say to them?
I say to them, get in for an examination. Give us a call, because we can now treat this disease without doing this cutting and stitching. We have the laser treatment that you have minimal pain and discomfort, as effective, as FDA approved, and works really well.
So the picture that I'm seeing right here, this bloody picture in these stitches, this is after the surgery, and that clean picture over there is
after
the
laser.
Yeah.
So
it's very nice. It's very nice. Good. Thanks for coming on the program. And
thanks for having me.
Good for you being one of the first guys to step up and get this laser.
Thank you, Randy.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online or direct a friend to the interview, you can visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.